What would you say in your practice that you see, or your knowledge of what the prevalence data is today? What is the prevalence of some type of female sexual complaints in women?
Oh, yeah. I mean, it depends upon age group and how you ask the question and blah, blah, blah. But about 40% is very similar to male. Erectile dysfunction, 40% by age 40, according to the Cleveland Clinic. Probably the same for females. So we're not unique. When we start like, oh, women are special. No, we're not unique. We're humans just like those humans. And we've got the same issues. And we need to address them just the same. But going back, a lot of people are like, oh, female sexual dysfunction. Some people don't have sex lives. And they're perfectly fine with that. We're never here to say you should be having sex. You need to be having sex. So a big thing about defining female sexual dysfunction is, are you actually bothered by it, right? And the second part of that is going back to how bad our sex ed is. Most people don't know that women don't orgasm by putting something in their vagina. So we're having women in heterosexual relationships having penis and vagina sex, never having an orgasm, faking orgasms. We have a disaster of a sex education. They don't know that the clitoris is important. People don't know where the clitoris is. So you have a woman come into your office, you got to step back and be like, okay, how do you have sex? What is it, an orgasm? You got to ask the right questions, because education goes so far. Like that lubrication helps orgasms, and people are all judgy about lube. Right? So we can get into the medications that are available, but I always say I never prescribe a medication on the first date unless it's vaginal estrogen, because they need the education. And that's why I say, go listen to my podcast, go read the book, start learning how to communicate, especially if we are talking a sexless marriage. It's been 6 months, it's been 2 years, it's been 8 years. And I would argue that the advent of Viagra was not great for relationships. It's a disruptor, and we have papers on that. Because when you provide one person out of 2 with better sex and you don't address their partner, whether it's genital urinary syndrome of menopause, pain with sex, low desire, you have created a rift. And I would say urologists are part of the problem, often more than they're part of the solution. When a guy comes to see me for Viagra, I always ask about a partner. Is there a partner involved? Is she seeing somebody? Are her needs being addressed? Have you communicated to her about your plan for bringing home the super penis? Right?
Right.
10 times out of 10, they have not talked to their partner about it. I think urologists are in the dark.